Have you ever wondered what life is like after a kidney transplant? This is a question that many individuals grapple with, whether they're facing kidney disease themselves or know someone who is. Kidney transplants are a beacon of hope for those battling chronic kidney diseases, offering a chance for a life less tethered to the restrictions of dialysis. To understand kidney transplants, we must first understand the kidneys themselves. These two bean-shaped organs located on either side of your spine are the unsung heroes of your body. They filter waste products, excess water, and other impurities from your bloodstream. But sometimes, due to various health conditions, these vital organs fail to function as they should. That's where kidney transplants come in. A kidney transplant is a surgical procedure that involves placing a healthy kidney from a donor into a person whose kidneys no longer function properly. This new kidney takes over the duties of filtering the blood, a task the recipient's own kidneys are no longer capable of handling effectively. Life after a kidney transplant isn't a walk in the park, though. It involves careful management of medications, regular checkups, and lifestyle changes to ensure the transplanted kidney can function optimally. The goal is to lead a normal, healthy life, but it's vital to remember that a transplant is not a cure. It's a treatment. One significant aspect to consider post-transplant is kidney rejection. This occurs when the recipient's immune system identifies the new kidney as foreign and attempts to attack it. But don't worry, we'll discuss this in more detail in later scenes. Now that we have a basic understanding, let's delve deeper into what happens during a kidney transplant. So, what exactly happens during a kidney transplant, you may ask? Let's dive right in. Firstly, every kidney transplant begins with a thorough evaluation. Doctors need to determine if the patient's body can withstand the rigors of surgery and the subsequent recovery process. They'll look at the patient's overall health and conduct a series of tests to ensure the patient is a suitable candidate for transplantation. Once the green light is given, the search for a compatible kidney begins. This could be from a living donor or a deceased donor. It's a meticulous process, as the new kidney needs to be as compatible as possible to minimize the risk of rejection. The day of the surgery arrives. The patient is prepared for surgery, which entails being put under general anesthesia. The surgeon then makes an incision in the lower abdomen, where the new kidney will be placed. It's interesting to note that the patient's original kidneys, in most cases, are left in place. The new kidney is connected to the nearby blood vessels and the ureter, which is a tube that links the kidney to the bladder. The surgery typically lasts for about 3 to 4 hours. Once the new kidney is securely in place and functioning, the incision is sewn up, marking the end of the surgery. Post-surgery, the patient is closely monitored to ensure the new kidney is functioning properly. There's a period of recovery, which varies from patient to patient. It's a time of adjustment as the body gets accustomed to the new kidney. During this period, patients start on a regimen of immunosuppressant medications. These are vital in helping to prevent the body's immune system from rejecting the new kidney. It's a delicate balance, maintaining enough immunity to fend off infections, while at the same time preventing the body from rejecting the new organ. That's the kidney transplant process in a nutshell. But what happens after? The surgery is over and the new kidney is in place. What now? Well, the journey doesn't end there. It's just beginning. Post-transplant care is a crucial part of the process where you play the starring role. This phase is all about medication, lifestyle changes, and regular checkups to ensure the success of the transplant. Let's talk about medication first. It's your immune system's job to fight off anything foreign, including your new kidney. To prevent this, immunosuppressant medicines are prescribed. These are not optional, they are essential. They help your body accept the new kidney, but remember, these medicines come with their own set of rules. The dosage has to be just right. Too much, and it can lead to harmful effects. Too little, and your body might reject the kidney. So, taking these medicines as directed by your doctor is critical. Next, we move on to lifestyle changes. Yes, the transplant gives you a new lease on life, but it also comes with responsibilities. This includes a healthy diet, regular exercise, and avoiding harmful habits like smoking or excessive alcohol consumption. A balanced diet will help your body recover and stay strong, while regular exercise can help maintain a healthy weight and reduce stress. Then there's the importance of regular checkups. These visits to the doctor are not just about checking the box. They are opportunities to monitor the function of your new kidney, to catch any potential complications early, and to adjust your medication if needed. Remember, symptoms may not always be present, but regular checkups can help detect any issues at an early stage. Let's not forget the psychological aspect of post-transplant care. It can be a roller coaster of emotions, and it's okay to seek help. Reach out to your healthcare team, join a support group, or speak to a mental health professional. You are not alone in this journey. So you see, post-transplant care is not just about taking care of your new kidney. It's about taking care of your entire self, body, mind, and spirit. It's about embracing a new lifestyle and being proactive in your own care. Post-transplant care is crucial, but there's another aspect to consider: the possibility of kidney rejection. What does it mean when we talk about kidney rejection? Well, in the context of a kidney transplant, rejection is a natural response from the body's immune system. It's the body's way of saying, "Hey, this isn't mine," and it starts to fight against the new kidney, treating it like an invader. Now, you might be wondering why this happens. After all, isn't the new kidney there to help? The thing is, our bodies are designed to protect us from foreign substances, and unfortunately, a transplanted kidney is just that, foreign. So how do we know if kidney rejection is happening? Well, the tricky part is that symptoms may not always be present, but when they are, they can include things like pain or swelling in the area of the new kidney, fever, or a decrease in the amount of urine. If any of these symptoms occur, it's essential to contact a healthcare provider immediately. To confirm whether rejection is occurring, doctors may perform several tests. These can include blood tests, kidney function tests, or even a biopsy, where a small piece of kidney tissue is examined. There are two types of kidney rejection: acute and chronic. Acute rejection happens shortly after the transplant, usually within the first 6 months. It's quite common, but also treatable. Chronic rejection, on the other hand, happens over a longer period and is, unfortunately, less treatable. If a rejection occurs, it doesn't mean the game is over. Treatment typically involves adjusting the dose of immunosuppressant medicines, which are used to lower the body's immune response and prevent it from attacking the new kidney. In severe cases, if the new kidney fails completely, dialysis may be required, and another transplant can be considered. Kidney rejection is a serious concern, but it's not the end of the road. With careful management and the right treatment, many people with kidney transplants continue to lead full and healthy lives. So, what can be done if a kidney is rejected? Let's dive right in. When the body's immune system identifies the new kidney as a foreign object, it tries to fight it off. This is what we call kidney rejection. It's an unfortunate occurrence, but don't lose heart. There are ways to manage this situation effectively. First things first, it's crucial to recognize the signs. The symptoms may not always be obvious, but if you notice anything unusual, it's important to consult your doctor immediately. This could include fatigue, reduced urine output, or sudden weight gain. Remember, the sooner we catch it, the better we can manage it. Now, let's talk about treatment. The frontline defense against kidney rejection is medication. Immunosuppressant medicines are designed to help your body accept the new kidney by suppressing the immune system's response. If rejection is suspected, your doctor may adjust the dosage of these meds or perhaps switch to a different type. The goal here is to find the right balance that allows your body to accept the new kidney without compromising your overall health. In some cases, when medication adjustments aren't enough, other options may be considered. This could include dialysis, a process that artificially performs the kidney's function of purifying the blood. It's not an ideal solution, but it can be a lifesaver in extreme cases. Average lifespan of a new transplanted kidney is around 12-13 years. In some cases, it can be more. In others, it can be less. It varies from individual to individual. In those cases, if a new kidney fails completely, another transplant may be considered. It's a big step and not one to be taken lightly. But with the right medical team and support network, it's a path that can lead to a healthy, fulfilling life. The bottom line? Kidney rejection can be a daunting challenge, but it's not insurmountable. With the right care, regular checkups, and a proactive approach to managing your health, you can navigate this journey successfully. Remember, a kidney transplant is a new beginning, not a sentence. With the right care and attitude, you can lead a healthy, fulfilling life. We've covered a lot of ground today, from understanding the transplant procedure to post-transplant care, and from getting to grips with kidney rejection to dealing with it. It's crucial to remember that with the right knowledge and guidance, managing life after a kidney transplant can become a part of your everyday routine. Stay vigilant, follow your doctor's advice, and always be aware of your health. Stay positive, stay informed, and remember, you're not alone in this journey. Our well-experienced team, with an experience of more than 1,500 kidney transplants, is there to handhold you through this journey. For any further help, you may reach out to Dr. Aman Gupta, Head of Kidney Transplant Surgery and Urology Team at Fortis Hospital, Vasant Kunj, New Delhi, India. Contact number for appointments 8448857369 for South Delhi Clinic and 96504-59393 for West Delhi Clinic.